Hi, Jonathan Hobbs here, developer of the Hobbs Masters Needling Series and chairman of the AACP in the UK. Rather than giving you some notes on needling in this session, what I'm going to talk to you a little bit about for a few minutes is a little bit on philosophy, okay, and some of the ideas that you can apply to your clinical reasoning. Of course, philosophy is a progression of falling in love with the idea of knowledge and falling in love with knowledge itself and a relationship and a progression of that. And we all like to think as clinicians we've got sound clinical reasoning, and hopefully we all have. When I'm teaching, I often use a lot of quotes from philosophy, and the reason I do this is because some of these very, very simple short quotes can encapsulate an idea and help you think clearly about what you should be, not what you should be thinking, but how you should be thinking, perhaps. Because I'm never one to tell someone what they should think, but I think it's useful to always think about how you think and always be thinking. A question that gets asked to me sometimes about acupuncture is, why do I do acupuncture? What's the evidence like? And so on. And some people say to me, they hear all these comments about acupuncture not having any evidence behind it, and that makes them question their practice. Great, you should be questioning your practice, but it's not about acupuncture. You should be questioning everything you do, absolutely everything. Don't get confused when people tell you there's no evidence for acupuncture. There's evidence of all sorts of types in all sorts of ways for all sorts of modalities, depending on the pathological presentation of the condition and the type of patient you're looking at and the environment at the stage they're in and so on and so on. And there's so many layers, and that comes down to the N=1 characteristics of that patient. But that exists for all modalities, all of them completely. It's not special for acupuncture, don't worry about that. So here's some ideas on thinking. When we look at some of the great philosophers, Voltaire said that uncertainty is an unpleasant situation, but certainty is absurd. And you need to think about that. When you think you know the answer to something, think again. Always keep thinking. Always entertain the idea. Aristotle said the sign of intelligence is the ability to entertain an idea without accepting it. So always keep your mind open that something else might be right and you might be wrong. You still might be right, but you also might be wrong. Because what you've got to consider is, if you're 100% right about something, that means that everybody else who disagrees with you is completely wrong. Now, is that the case? Think on what's the chances that everybody else is wrong. So always keep that in mind. Another quote that springs to mind is that you should always admire the man who seeks the truth, but never trust the man who tells you he's found it. There are so many layers in things, and when we're diagnosing, it's always your diagnosis of best guess, really. It's always your diagnosis of exclusion. We remove everything it can't be, and that reminds me of that quote by Sir Arthur Conan Doyle, which is when you remove the impossible, whatever's left, no matter how improbable, must be the truth. And that brings us again to the concept of Occam's razor, that all things being equal, the most obvious answer is probably the correct one. Or, commonly put, if you hear hooves, think horses, not zebras. And we can do that when we're thinking about clinical practice. We'll run through our diagnosis, we'll go through our subjective, we'll go through our objective. And if your subjective's good, your objective should have no surprises, really. It should confirm what you're already thinking, but keeping your mind open, putting those layers in. And then when you're clinically reasoning what treatments to do, you're thinking about that evidence base, you're thinking about that published evidence, you're thinking about your experience, you're thinking about the patient preference, and you're thinking about the context as well. And it's a complete picture of all those things. So those are just some ideas on perhaps how to think and clinical reasoning. Keeping your mind open, always entertaining an idea, always thinking about those layers. And one thing to remember when it comes to any treatment that you're doing is another quote from Voltaire, which is, medicine is the art of entertaining a patient while nature gets them better. Think about the physiology and what that's doing while you're taking the credit. So I'll chat to you again soon. We'll talk more about needling, we'll talk more about clinical reasoning, and we'll talk more about application. You take care. All the best.